Welcome to the Deep Dive. Today, we're plunging into one of healthcare's really tough nuts to crack, the challenge of addiction.
Mm-hmm.
It's a problem that, well, it costs us so much in lives and economically, right? And it often leaves healthcare systems totally stretched thin.
Absolutely. And patients are often left struggling to find the help they need. It's a critical issue.
Yeah, the demand for care just seems to far outstrip the available integrated solutions.
You get fragmented pathways, and that, unfortunately, just increases suffering.
And that's exactly why we're doing this deep dive today. Our mission is really to unpack this partnership model.
Right. One designed specifically for federally qualified health centers, FQHCs.
We want to uncover how this model helps FQHCs,
Yeah.
seamlessly integrate and expand addiction treatment, specifically medication-assisted treatment, or MAT.
So looking at how it tackles those big challenges, operational, financial, patient care.
Exactly. Could it potentially change the course of addiction for many people?
And what's striking right from the start is the promise here,
Which-
providing comprehensive, stigma-free access to care right there in the existing clinic spaces.
All under one roof?
And crucially, without adding extra staffing or training burdens on the FQHC itself, enhancing services without overwhelming them.
Okay, so let's make this concrete. Our sources mention a Solvera case study. Let's use that.
Good idea.
So imagine an FQHC like Solvera. They're doing great work, and then boom, their substance use disorder prescriber leaves.
That happens, and it creates a real problem.
A huge dilemma,
Yeah.
right? Do they refer patients out, knowing they might just get lost, maybe lose touch with the FQHC for their primary care, their psych meds, everything?
It's a risk, a big one.
Or do they try to rehire, which means long lead times, finding someone specialized?
And someone who fits their philosophy, which isn't always easy. It's a tough spot.
That really highlights a common pain point, doesn't it? Maintaining that continuity, that trust.
Definitely. And this is where, according to our sources, the Brightside partnership comes in as a compelling solution.
How so?
It brings expert satellite services directly on site, integrates with basically any EMR system.
Right.
The FQHC keeps control of the patient relationship, handles the billing.
While Brightside manages the specialized care, fills the gap.
Precisely.
And this isn't some new, untested thing.
Not at all. The sources say Brightside started back in 2015, so a decade of experience, multiple providers. They've been doing this a while.
So what did Solvera in the case study say about it?
Really positive feedback. They said, by bringing Brightside providers directly into our clinic space, we ensured seamless, stigma-free access to comprehensive care all under one roof.
Seamless and stigma-free, that's key.
Yeah.
And patient feedback.
Even more powerful, I think. One patient was quoted as saying, "It was the first time I felt like everyone was working together for me."
Wow. That feeling of collaboration is huge for someone navigating addiction treatment.
It really captures the essence, doesn't it? Breaking down those silos, fostering holistic support. It's more than just medical treatment. It's building a supportive ecosystem.
So let's unpack the core benefits for the FQHCs themselves. What does this partnership really offer them?
Well, the big one is extending access to MAT without the FQHC needing to hire more staff or train their current team for it.
Okay, so no new hires, no extra training burden.
Right. And they keep full oversight of the patient relationship, the care delivery. They're leveraging a proven model, meeting that growing MAT demand without disrupting their own operations.
Sounds like a major win.
It is. And another crucial aspect our sources highlighted. Brightside actually adheres to FQHC standards.
Meaning?
It's not just plugging in an outside service. They align with the FQHC's mission. They use a sliding fee scale, embrace harm reduction, prioritize that interdisciplinary care coordination.
So it truly integrates. It fits the FQHC way of doing things.
Exactly. It becomes part of their patient-centered approach.
Okay, let's shift gears a bit and talk money. Because this seems, kind of transformative. Our sources suggest this isn't just a vital service, it's financially strong.
Yeah, the numbers are quite remarkable. It operates on a fee-for-service model.
With a profit margin of, 46 to 51%?
That's right. Impressive. And reimbursements, often within 14 days. They call it Medicare-like speed.
14 days. That's incredibly fast in healthcare billing, isn't it?
It absolutely is. Speaks volumes about the efficiency of their revenue cycle.
So explain the PPS reimbursement again. How does that work in this model?
Okay, so under the prospective payment system, PPS, FQHCs get a fixed payment per visit, right? Say $185 to $202 for an eligible visit.
Regardless of the specific services in that visit.
Generally, yes, for that encounter. So Brightside's fee is $100 for their specialized service within that visit.
Ah, I see. So the FQHC gets the full 185, 222 PPS rate,
Correct. They pay Brightside $100.
leaving them with a net margin of $85 to $122 per visit where MP is provided.
Exactly. They add a high-value service, generate a healthy margin. It shows essential care can be financially sustainable.
And then there's the pharmacy side, the 340B drug pricing program. That adds another layer.
A very significant layer. 340B lets FQHCs buy certain drugs at huge discounts.
And bill insurance at normal rates.
Right. This partnership helps them really maximize that. With buprenorphine, maybe $200 profit per script.
Wow.
And with Sublocade injections, it could be a $925 profit per injection, maybe even more, depending on the specific rates.
Those are serious numbers. Significant new revenue.
Definitely. And beyond direct revenue, think about the operational efficiencies.
Like what?
Seamless EHR integration, claims processed super fast, often within 5 days, streamlined documentation.
And a staffing.
Brightside provides the M@U trained staff, so no hiring burden for the FQHC. Plus, telehealth support means no need for extra clinic rooms. It's efficient all around.
We've hit finance, operations. Let's focus on the patients again. Retention, engagement. How does this model affect that?
This is really interesting. Patients getting addiction treatment often need more frequent touch points. They come in more regularly.
So more contact.
Yeah. And when they're already there, Engage for Matt, it opens the door. It's a natural opportunity for primary care, behavioral health check-ins, other services.
They become spicky patients, as the source material called them, more likely to stay with the clinic.
Exactly. They stay engaged month after month. It creates this positive cycle, better health outcomes for them, increased visit volume for the FQHC.
Is there data on that? How many MAD patients use other services?
Yeah, quite compelling data. One source indicated 67% of MAT patients also engaged in primary care or behavioral health services at the same FQHC.
67%. So it's not just about addiction, it's about connecting them to comprehensive care.
Precisely. Fostering whole person health.
Let's go back to Solvera. How did it look there?
Okay, so they had 43 patients treated by Brightside at that FQHC,
Okay.
consistent with the other stat. 67% of them got additional services, PCP, behavioral health, psych. Only a third got just MAT.
So 2/3 were getting broader care.
Right. And even more telling, 1 in 5 of those MAT patients showed a need for more or earlier treatment from the FQHC's own providers.
So Brightside's involvement helped identify other needs.
It seems so. And get this. 100% of patients needing meds or injections got them from the FQHC's pharmacy.
That's real integration, a true continuum under one roof.
It is. And that level of integration provides a really crucial safety net, especially with a big rule change coming up for Medicaid.
Right, the work requirement. Remind us about that.
Starts December 2026. Basically, ACA Medicaid recipients generally need to work 80 hours a month to keep coverage, unless they're exempt.
And the key exemption for this conversation is?
Patients formally diagnosed with substance use disorder, if it's documented and they're getting ongoing treatment.
So this partnership, by providing documented ongoing treatment.
Exactly. It offers a clear path for these patients to keep their Medicaid, maintain access to all their care, not just MAT.
Which is huge for the patient.
Yeah.
And for the FQHC.
They can maintain the proper documentation needed for that exemption. It keeps vulnerable patients connected, prevents them falling through the cracks, though, specifics will vary by state.
That's a massive benefit, potentially life-changing. That goes way beyond just the treatment itself.
It really does.
Okay, let's talk outcomes. Our sources stress this is evidence-based, harm reduction focused.
Yes. Brightside prioritizes keeping patients in care, not dismissing them for positive screens. That supports reimbursement, sure, but more importantly, it leads to better outcomes.
Makes sense. And care coordination.
Improves. Having addiction specialists manage complex cases frees up the primary care docs for broader care.
Any stats on how this impacts things like ER visits?
Yeah, pretty striking ones. Only about 10% of these types of patients end up in the ER for drug-related issues in the first year.
Only 10%. That's low.
It is. And medication adherence is around 71% for these patients. Compare that to maybe 50% for other chronic conditions like diabetes or hypertension.
So better adherence, fewer crises.
Lower total cost of care for the patient, positive impact system-wide, it all connects.
And operationally, other advantages. You mentioned staffing.
Right. Having credentialed addiction pros through the partner reduces the FQHC's HR load. No recruiting, hiring, managing those specialists.
And telehealth.
Increases reach without needing more physical space. Big plus.
What about attracting new patients?
That's an interesting angle. Offering SUD treatment can make an FQHC a referral magnet. Hospitals, ERs, advocacy groups looking for Medicaid continuity solutions, they'll send patients there.
Becomes a go-to resource.
Potentially, yes. And compliance-wise, the encounter-based billing, not per member per month, and documentation aligned with federal rules that helps with audits, claims, it's built for compliance.
Okay, let's tie it all together. The ROI, the bottom line, what did the projections look like?
For an FQHC with, say, roughly 100 patients in this program, the sources estimate annual incremental profit around $390,000.
$290,000 profit.
Yeah. That's from about $572,000 in total SUD-related revenue, medical, and pharmacy minus the costs. It works out to about a 68% estimated profit margin.
68%. That's substantial. It shows that providing this critical care can actually strengthen the FQHC financially.
Absolutely. It allows them to reinvest in their whole mission.
So just to recap the key ROI drivers.
You've got the solid PPS reimbursement per visit, $185 to $202, big pharmacy margins from 340B. Reduced staffing burden.
High patient retention, new patient referral.
Fast, reliable billing, built-in compliance. The crucial Medicaid protection for patients. And all those extra service opportunities, primary care, behavioral health.
It really is a comprehensive package, isn't it?
It seems to be, yeah.
What an incredible deep dive. This model really appears to hit all the marks. More revenue, lower costs, better patient outcomes, wider access, smoother compliance, helping FQHCs fulfill their mission.
It does. And it leaves us with a big question, I think. How might this kind of financially viable, operationally efficient model change public health more broadly?
You mean beyond just addiction?
Yeah. Could integrated models like this transform how we approach other chronic conditions? Could they really break down those traditional silos and make community health truly accessible and effective for everyone? Something to think about.